When nature calls, there's a problem here in Okokroko. The over 1,000 residents of Okokroko and the Techima North share a similar problem. They have no toilet. A common sight every morning. People carrying machetes. They travel miles through the bush before they can relieve themselves in the nearby open spaces, as Kwame J is doing. He creates a small hole in the ground and then squats to relieve himself. He has been doing this for over a decade.
Any turret, abamba ko bet. The abambiaba ana the obiaba can say a harakoye kurasi.
We don't have toilets here, and successive governments have done nothing about it.
Kwame is careful when in the bush due to his brother's experience.
Black Cobra, Tuntumri,
My brother was bitten by a snake. Others have also been bitten by scorpions. We need a toilet facility, but who will help us get one is the big question. All of us, including women and children, practice open defecation in this area.
Children are also exposed to dangerous reptiles, especially at night. Nature's call can be unavoidable when it comes, and here in Kokoko, defecating in the bush is a norm for everyone. This little girl right behind me is just 7 years old, and I have been told that she started defecating in the bush when she was just 2. Not just her, the elderly, together with other boys in the community, also defecate in the bush. She is not only exposed to deadly reptiles which can easily bite her, but this is a practice that is not good for a little girl like her.
When it rains, the erosion rob all the that feces to the riverside, so that all the rivers that spread, we can't even drink it. So it has been a headache to me.
According to the 2021 National Housing and Population Census, about 18% of households in Ghana do not have access to a toilet facility. The proportion is over 3 times as much among rural areas, which is 31.3%, to urban areas, which is 8.9% households. Open defecation, according to the report, is prevalent in all the 16 administrative regions of Ghana, with 5 regions recording more than 50%. What it means is that about 5.5 million people in Ghana practice open defecation. Under a public-private partnership with the government, Ghana First was to build 10,000 automated toilets to eradicate open defecation under a Clean Ghana project. But 5 years later, the goal is still not met. On April 11, 2022, Sanitation and Water Resources Minister Cecilia Abnadapa assured this ministry will ensure that every household gets a toilet facility to help reduce the menace of open defecation.
Every house should have a toilet. It beats my imagination that in this 21st century, we still have people with homes without toilets. That's why we have introduced the biodigesters. They need a small place to be fixed, and one can cater for 6 people.
That is yet to be achieved, especially for the people of Okokroko. Member of Parliament for Techima North, Elizabeth Ofusujare, wants government to do more to tackle the menace.
Even though the district assemblies want to tell us that public toilet is not fashionable nowadays, I still think it is better than defecating in the open. You have situations where a man is squatting, a woman is squatting next to the person in the name of nature's call. So I think that until we reach the stage where everybody can have a toilet in their homes, it is fair that we provide public toilets. I've done about 5 on my own. And so I think that government, central government, when we sell our cashew, we give the government taxes. When we sell our tomatoes, the government does not spare us of taxes. So it is very, very inhuman and unfair that common toilets government cannot provide the constituency. I think the government should be up and doing in the area of our sanitation. This is very urgent.
According to the World Health Organization, countries where open defecation is widespread have the highest number of deaths of children under 5 years. More needs to be done to address open defecation in Kokoko and throughout the country. Godwin Asidiba, TV3, Okokroko, Bono East Region, Techiman North.